list, and sadly, they are not very cooperative. And so here's where we got to get a little brutal, and we have to cut on either side of the pig's mouth through the jaw. These are fetal pigs, and so their skeleton is largely cartilage at this point, so it will cut fairly easily, but it can be sometimes a little upsetting, so if you're squeamish, get over it. I don't know. Really not a better solution than that. We do the cats in CVI need bolt cutters, so that's pretty brutal. So yeah, at least we do it with scissors. So these dissections, not just today, but all of them, are almost entirely going to depend on scissors, because the purpose of a scalpel is to make a nice clean incision that will heal without a scar. And that is not an issue here, I'm pretty sure. If it is, talk to me, because we got a zombie pig movie we can make with that, if nothing else. So using scalpels is bad for two reasons. One, they cut indiscriminately through layers of tissue, and sometimes you cut things you don't want to cut, and part of your grade is for not damaging things, so you don't want to do that. And two, the tissue they cut indiscriminately may be your own. And so they're much higher risk of injury for very little benefit in terms of what we're doing. So just ignore the scalpels. We're not doing surgery, we're doing dissection, and dissection is with the blunt edge toward the pig, because any damage that's done will be minimized by using the blunt edge versus having the sharp edge be jammed in the pig's mouth. And then what I will do, and this is hard to do with the lights and everything in the way, but I'll do as well as I can so you can see it. Pry the mouth down a little bit, take my scissors, and cut through the jaw. And this will probably take several cuts. I want to cut all the way across the cheek, so down to about as far back as the eye goes. And then do the same thing on the other side. And now that I've cut through the jaw, I can see some of the items on the ID sheet are already exposed. The first couple of items that you see are on the roof of the mouth. These are this hard and soft palate. Zoom in a little, make that a little more clear. All right, so the hard palate will be both visually and tactilely very distinct. It has these clear ridges on the surface of it, and if you run a finger or a probe over that, you will feel that these ridges are made of bone. So the hard palate is the portion of the upper jaw that holds the upper teeth. And so it has to have that bony support structure in place. The soft palate will be further back behind that. In my case, it's ripped a little bit, but the soft palate is going to be soft tissue, muscle, connective tissue, things like that. The purpose of the two palates is, in the case of the hard palate, is to hold the teeth also, but the two palates also separate the nasal and the oral cavities. So that means that while you have something in your mouth, you can potentially at least still breathe through your nose.
So that it separates the oral
and nasal cavities. But this is also the whole making somebody laugh and having the milk or whatever come out their nose thing, because as you swallow, there's a point at the back of the throat where the oral and the nasal cavities cross. And so if you have something in at that location, a puff of air comes out when you're laughing, it will tend to go out the nose and carry whatever liquid was in your mouth at the same time. So that is both hilarious and disgusting, which is pretty awesome. That was the bonus in grade school. We got to do that stuff. So you'll find that further back in the mouth where those things are not present, but their job when they're intact is to keep those two things separate. The tongue, I hope we don't need to identify the tongue. We all know what a tongue is, but the tongue is right there, pretty obviously on the lower jaw. And then the last few items are a little trickier, so I'll show them, and then I'll have you doing your dissections, and I'll come around and help you find it, because these can be a little bit hard. Here's where it gets a little bit more brutal. We got to fold this down further. You basically want the lower jaw to rest easily on the animal's chest, which means you got to break and tear a little bit more. So, like I said, it gets a little brutal and a little real, but you got to do what you got to do. And you may need a little bit more scissor cutting if the jaw is sort of impeding. You want to get it down far enough so that you get all the way to the back of the tongue. And when you do, there's a little sort of turkey timer thing that pops up. That little flap that I'm moving right there at the back of the tongue, that's the epiglottis. The glottis is the opening. So glottis is the opening to the lungs. It passes, well, it's open to the trachea. So it's a respiratory pathway. Epi means on. So the epiglottis is this sort of U-shaped flap that sits on top of the glottis. And the purpose of the epiglottis is that when you swallow, you can feel this. that's slimy, but you feel at your Adam's apple area, you swallow, you feel it go up. What's happening is your trachea and your larynx move up, and that pushes the epiglottis closed, covering the airway, so that any food or liquid you swallow goes down the back to the esophagus to your stomach. We've all experienced that swallowing, have it go down the wrong pipe thing. That coughing fit that you get is your diaphragm spasming to push air out of your lungs and hopefully carry whatever it is you swallowed with it. Up until the Heimlich maneuver's invention, dying from choking was like the third most common type of accidental death. Because if you talk while you're eating, as people do at dinner when they're out with friends, you are more likely to swallow something that goes down the glottis, because when you're talking, the epiglottis can't be closed because air has to come out to make sound. And so if you're talking and eating and swallowing, you can't close off your epiglottis all the way, and therefore there's a much higher risk of food going down the airway first. And when that happens, if it gets stuck, you're out of luck. Question?
So the epi-
On either side. So the glottis is the opening that I've inserted the probe into. So it's right inside the epiglottis. But if you fold that down, you'll see a large, so if you see right here, you can see how my probe is inside. So the epiglottis is that U-shaped piece that I've bent down with the probe in the glottis. I've got that larger opening behind that. That would be the esophagus. And that would be the opening that leads food down to your, well, food or liquid down to your stomach.
So the epiglottis was that